Brianna here with another installment of our Insider Perspective interview series. Today, we are joined by Faith Adole, who is a family nurse practitioner and nurse leader who is passionate about a great number of things, but namely healthcare advocacy, public health, and improving healthcare access for underserved communities, both locally and globally. She is a current DNP MBA candidate at Johns Hopkins, and she is also the founder and CEO of Uofl Foundation Incorporated, which we will get into in just a bit. So welcome, Faith. Thank you for doing this with us.
Awesome. Thank you. Thank you for having me on to the whole nurse community. So excited to chat with you guys today.
Awesome. Tell us how you got into nursing.
Sure. The big question. So
right.
I started as a registered nurse at the bedside in an acute care setting, like many nurses do. I started on a med-surg oncology floor in a mid-sized hospital. And from there, I kind of moved around to different parts in an acute care setting, telemetry floor, and ultimately I specialized in a neurostroke floor. And from there, I actually navigated out of acute care setting, went into home health and ambulatory care, then eventually advanced practice, leadership, and now global health.
Awesome. Yeah, I love hearing nurses' journeys up until like present day, because there's no two stories that are ever alike.
Right,
We had a similar trajectory actually in acute care. I followed a lot of the same pathways that you did. That's great. And then let's move into the meat of the work that you do now, because you're doing so many amazing, there must be like 3 of you, because I don't know how one person can do all the things that you're doing right now. But let's start here. You wrote an article that's titled 7 Steps to Ensure Quality Global Health Missions. We hear so much about this. We've written articles about if you want to be like a, health missionary type person. But there's not a lot that goes into qualifying these. I think from the nurse's perspective when you're looking into it. Tell us more about this article that you wrote, how you got interested in this topic, why it's important for nurses to know about this.
Sure, absolutely. I was really inspired, I think, to write about that topic because it's kind of where I was at personally and professionally. And I was thinking about, at the time, things that I've seen on the global health field, kind of the good, the bad, and the ugly, and where do we go from here type of a thing. So there's no doubt that, medical missions and other short-term healthcare relief missions really help bring healthcare quickly, to those that need it the most. And I emphasize quickly because there are millions of people, even right now, that are dying or are gravely ill from preventable illnesses. And without this aid, many people won't have the opportunity to access anything like that. So at the same time, though, with missions, there's always at the same time, when it comes to missions, there's I guess a challenge that presents itself in that people can be exploited, or there could be missions can be used as just opportunities for the countries that are going over there. So maybe people that want to practice, like nursing students, medical students, very egocentric or something like that, or just feel good opportunities that I went somewhere in Asia or Africa and it felt so good.
Like mission, like tourism almost.
Yeah, exactly. And it completely takes away the focus from what our mission, why we're going there, and who's the focal point, which in healthcare, it should always be the patient and the community and those that are in need. And I find that global missions are a part of healthcare, just as the clinicians that are a part of it are a part of healthcare, and should be held to the same like ethical, moral, and even clinical best practices, just like other healthcare settings. I really just wanted an opportunity to start a dialogue and a conversation with colleagues.
Yeah, that's such an interesting, I mean, I could talk about that one point all day long because
Right.
we live in a time right now. I mean, I'm like thinking of all the terms like trauma porn and all those things that you hear of like
Right. Yeah.
people like exploiting emotional situations to make
Mhm.
content or to do like PR stunts or like you said, centering the practitioner rather than the patients.
Yeah.
And it's all very problematic, but to talk about it on a level that like works to understand why that happens and then also how to address it, while pushing it back onto like the patients in the communities that, like you said, need help today, um, is such an important conversation for people to be having. I think it's so interesting. I haven't heard a lot of people talking about it, so I'm glad we have
Right.
you on here right now to hopefully pique people's interest to think about it in a little bit of a, um, more critical or compassionate way. Um, Tell us about the foundation that you started, Uofl Foundation. What's the mission? What does it stand for?
Sure. So Uofl stands for United Vessels of Love Foundation, and it's an 501(c). It's a nonprofit healthcare international foundation that I founded in 2015. And really, our focus and mission is to help bridge gaps in healthcare for vulnerable populations. And we do that through medical outreach, health education programs, water, sanitation, and
Mm,
other, healthcare sustainability initiatives.
yeah. How do you guys find the communities that you serve? Do you have like an application process? Do you go out and find them? How does that work?
That's a great question. Actually, as a team, we work to, I think we're always, different communities are on our radar, I guess.
Hmm.
And there is a research or assessment, rather, is a better word, portion of the work that we do. So keeping our eyes and ears peeled,
Hmm.
to the ground and seeing what's going on. One of the current communities that we're working in Nigeria, we
Mm,
actually saw a lot of media reports, written news articles, things on TV within the host country about an issue, a problem that was going on in that region. And so that
mhm.
alerted our team to go over there and assess what was going on and to see if possibly we could help or be a partner.
Yeah.
Sometimes, yeah, and sometimes that assessment isn't necessarily for us to ourselves to do work there, but also to be an advocate or a voice, since we're
Hmm.
not specialized in everything, and
Sure.
we communicate with our partners.
Yeah. What was the concern over there, if I may ask?
Yeah, it was a water contamination. Actually, the start of COVID, beginning of 2020, there was a region in central Nigeria, of Benue State,
Hmm.
a local government area or a county. It's called Obi, and they had this very bad water contamination in their local stream,
Mm,
and it was killing a lot of people. And that's because
yeah.
their main source of water was this stream. And I
That was
actually,
it. Yeah.
it was, but it actually still is. It's
Yeah.
a very huge stream that goes throughout the community. So we've been able to help some parts, and now they have water, but there are several thousands of others that don't. And why it
Yeah.
was so significant, and I mentioned beginning of COVID, is because everywhere in the world it was lockdowns and
Right.
everyone was focused on COVID.
Yeah.
And there's so many other things going on at the same
Right.
time.
Yep.
And it being a remote location, people couldn't get there like fast enough.
Right.
People died,
Uh,
and we're like, okay, we learned
yeah.
about this region, and they've had an ongoing issue with water for a very long time.
Right. I mean, it's something that obviously most of us in this country take for granted completely. But it's a foundation of life. You need clean water. I mean, there's
Right.
no,
Yeah.
yeah, it's just something as simple but profound as that. Yeah, it can, like you said, have devastating consequences. Um, Tell us a little bit more about the documentary, a project documentary, the Solar Powered Clean Water Project documentary. What inspired you to come up with this project?
Sure. So We've been doing a lot of Uofl since its inception. So here in the US, we focus a lot on homeless populations, healthcare related issues that they face. And internationally, it's been healthcare, medical care. And we had never really dealt with water before. However, with something unique about healthcare is that it's always evolving. Like 6 months from now we'll be focused on something else than we are
Yeah.
right now. And I really believe that organizations should be open to pivoting and moving and changing, even if,
Right.
as a nonprofit, their bylaws say this. And yeah, so for us, we really decided to bring in water because we noticed a lot of the communities that we're already working with overseas were always dealing with waterborne illnesses. Like it was the chief complaint.
Yeah.
So whenever we do an outreach mission, we collect information so that we know, what's the most prevalent issue that region is dealing with, and see how we can help them then and beyond after we leave with partner organizations. So we found that waterborne illnesses over and over, and the regions that we're working in didn't really have many options for water. And we had seen that, I believe UNICEF was one of the great organizations that worked in one of the regions that we were in, but UNICEF is everywhere and they're doing a lot. And many people ask, well, why did you start water? Because the need is so great and there are so many regions that still need help.
Right.
And Uofl really switched intentionally its focus to a sustainability capacity building model for the communities that we engage in. So we felt like that needs to be comprehensive.
Yeah.
And water, sanitation, and hygiene are a part of healthcare.
Right, exactly. Those are such interwoven things. Like you said, it's the water is the basis for our springboard for so many different ailments that people can have down the chain. Yeah, I can imagine there's never an end to it. But it sounds also, what I'm hearing when you're describing your organization is a basic tenet of nursing, which is connecting people with resources, even if you yourself aren't the one that will be providing them. And I love that because that's just intuitive to what we do and we practice anyways. That's an important part of being able to be selfless, I guess, as a community organization too. I think like we were saying at the top about like the self-promotion aspect of some mission work, and really being able to take yourself out of the spotlight in it to focus on the communities that you're helping. Talk to us about what you see down the road for your foundation 5 years from now. What's in store for Uofl?
Yeah, so really right now and in 5 years, Uofl is really focused on building its infrastructure for its existing programs, and that includes our personnel as well. Making key collaborations with different partners so that we can learn from others and do what we do better. And then ultimately is just for greater impact. We're really focused on making healthcare more accessible and at the same time equitable to communities that we serve and beyond.
Yeah. What have you seen? It makes me think of one of the big things that gets talked about a lot right now is the distrust of the healthcare community as a result of, COVID being a big perpetuator of it, but also building upon decades of, health systems that have undermined certain communities. What have you seen on that end in terms of like building back some of those bridges so that nurses and nonprofits can be trusted again?
Yeah, I really think it's time for greater transparency as organizations, leaders, and that transparency involves accountability. So acknowledging the places where we have maybe missed the mark and saying, well, before we were strictly, doing missions like this, but we realized we were wrong and we decided to change that. I think
Yeah.
that the general public would be more, would be supportive of that.
Right.
I think a lot of, maybe saving face or
Mhm.
not acknowledging issues that are there, inequities
Mhm.
that are there, only
Yeah.
perpetuates the problem and makes it worse. So,
Right. Absolutely. I don't know if you saw today, I saw a blurb come up about the CDC doing exactly what you just said, kind of saying, we did a lot.
oh, okay.
Turns out we did a lot wrong. We didn't actually trust the public with no, like, I think they used the word truth, which I was like, oh God, that's just gonna
Yeah.
help other people's agendas that don't need any little sound bites from this, statement that you're releasing. But I thought that was important, though, that they just said, like, we didn't do this perfectly. And not just that, like, here are the things that we did that were absolutely counterintuitive to being a public health institution. And, now that we have
Right.
monkeypox and trying to right some of those wrongs, which, but anyway, it just made me think of that when you were talking about
Mm.
let's switch gears a little bit and talk about community, empowerment, engagement. How do you get people on board when you're trying to do these big public health initiatives or even global health initiatives?
Mhm.
How do you get that engagement and buy-in?
Sure, from the communities themselves.
Yeah, from the communities that are, like you mentioned, homelessness, where a lot of people literally step around it in their daily lives and don't realize, the health issues or any of the issues really. I read a study one time that talked about how I don't know how they like quantified it, but it was like brain scans maybe where they were flashing images in front of people's eyes, and what a lot of them had to do with homelessness. And some people viewed them more as like an object, and some people viewed them more as a person. And I thought that was
Exactly. Yeah.
so telling. Where some
Yes.
see it as like a landscape issue, which is
Mhm.
horrifying, and other people are able to see like the people that are living in those
Yeah.
situations.
I think you hit the nail on the head. It's people want to be seen, people want to be heard. It's a part of human nature.
Yeah,
And we find that
sure.
with the communities that we serve in, whether it's homeless communities or international communities that are not experiencing homelessness. So, really, we focus on building trust and showing that we're committed.
Hmm.
Specifically, so we've been doing work since we started in Southern California, and as you may know, Southern California has a huge homeless
Right.
issue that's multifactorial,
Yeah.
and a lot of the people that are experiencing homelessness in different facets, whether on the street or in transitional housing, engaging with them, I find that they say they've kind of heard this before or that before, or it might be jaded in a sense. Some of
Yeah.
them, well, or it could be stemmed from fear. They may not want to go somewhere or engage because
Yeah.
of fear of being turned away or being overlooked or viewed as a number for so long.
Mhm. Mhm.
So that affects how they move and whether or not they're open.
Yeah.
So we really try to meet each community where they're at. So
Mhm.
we just did an outreach, for example, in San Bernardino County, that's east, about an hour and a half east of Los Angeles.
Mhm.
And the way we approached that specific community was different from how we approach LA County, et
Yeah.
cetera. And it really depends. We try and create environments that are less threatening. So if we do an outreach, we see that there's a need. If a person is in a desperate or survival mode, there
Mhm.
is a part where they need somewhat of relief. They're
Yeah.
thirsty, they want something to
Yeah.
eat.
Right.
But at the same time, and instead of just approaching them, it's like you have a mental health problem, or you
Right.
need to go to this program. Here's my
Yep.
brochure. With multiple
Yep.
community partners, make sure we are well informed as you all is what's available in this community. What does
Mhm.
this particular population in this pocket of, say, San Bernardino have
Mhm.
an issue with? And we talk a lot with our partners and say, okay, you have a shelter in this area. What are some of the challenges that you have found with this group or population? And we
Mhm.
just find avenues that we can help them.
Yeah.
So we facilitate a lot in what we do.
Right.
And more specifically overseas in communities that have never even heard of Uofl, and we might show up and say hi. It's a lot of similar things, but a lot of learning goes on. And a part of that learning, I think something that is standing out to me is respect. So
Mm-hmm.
respect for people's land, their leaders, their practices that are
Mm-hmm.
already going on before you even get
Right.
there, and really
Yeah.
listening and and being more of a partner alongside instead of, I would say,
Yeah.
leading a conversation and imposing and saying, well, this is what we think we should prescribe,
Yeah.
because
We
a lot
know
of
we
the
know better
times
than you
it's
do.
not.
Yeah.
Yeah, it's
Yeah.
exactly.
Yeah, I think any nurse, I mean, just on a relatable level to people that maybe haven't done like any sort of community work or volunteer work, is just watching like a physician completely miss the mark with a patient that, you might have developed a great rapport with because you've
Yes.
been spending all shift with them. But then the
Yeah.
doctor comes in, and no offense to doctors, they're not all like this, obviously.
Mm.
But the ones that are like this, everybody has met or interacted with at least one, and you're like watching this, like they're not listening to a word you're saying because
Yeah,
you're just talking at them, and
exactly.
that's such a key component of communication. And without communication, like you're doing nothing to change this person's life, even though like you're technically right and the information you're saying is correct. It doesn't
Uh-huh.
matter because that person's not
Exactly.
listening to you. Yeah.
Yeah, you just hit the core of nursing practice, and I wish it would be healthcare practice, but definitely in nursing, we talk a lot about like nurse-patient relationship, and
Yeah.
the core of any relationship is like trust, respect,
Yeah.
displaying care and love, and those things take time. Whether
Right.
at the bedside,
Exactly.
it could be a shift of 12 hours, but you're still spending time and you're
Yeah.
showing up whether or not that patient is being nice to you or not,
Yeah.
or whether or not there's constraints of pressure on the shift. Same
Mm-hmm.
thing in the mission
Yep.
field, if you don't have the most hygienic field or anything like that, but you're still showing up no matter what, and those
Yeah.
things display to the recipient that I can trust this
Yep.
person. They mean what they say, and they're going to come back, and they
Right.
mean the best for me.
Yeah. That's such an important aspect of it. Tell us about some of the challenges, which I'm sure the list is endless. But in your role specifically with public health or the global health missions that you've worked on.
Sure. I would say overarching in global health and public health, for my organization and others, one of the main challenges is that public health delivery is really no, it's married actually to our stakeholders, and it could be different partners from
Mm-hmm.
the government to the local community to other organizations. And a lot of the countries that we do global health work in, it still lacks like
Yeah.
basic healthcare, basic infrastructure, basic things for personnel that deliver the healthcare. So coming in
Right.
and trying to partner with a place that doesn't have the basics, you've got to advocate and convince those that maybe have
Yeah.
the power to create that infrastructure, to tell them this is important, we need to do
Right.
this, and here's why.
Yeah.
So I
Yeah.
think that's been one of the biggest challenges for many of us, and especially Uofl. Some people ask, oh, well, how come you're not yet working in this country or this region or this part? And I tell them, well, if you want to really make long-term impact, it takes time. And we're
Right.
not really focused on, as many, I don't know, pictures that we can get or social media likes, but
Yeah.
we're really interested in investing in people's lives and
Yeah.
helping people long-term.
Yeah. It's hard to argue with that, I think. I can also imagine like that must just be an insanely frustrating part of your day to day.
Mhm.
Like the passion, I imagine, comes from wanting to help people, but then the necessity of needing funding is you
Yeah.
need it. So having to like convince people of the importance of your work, I mean,
Yeah.
I don't know if I'd be cut out for that, but that's
And even
definitely.
within the countries, to give perspective, there are some regions that are very much interested in working with us and we working with them, but
Mm,
maybe the roads getting there are really bad. And
yeah, right.
if we need, large vehicles or different machinery to get in there,
Yeah,
we need better roads. So sometimes we engage, with members of the government and say, these are the issues we've
right.
seen
What's
in
holding
this
us back?
area, but if it's
Yeah.
not a priority to that government at that time, or they don't want to release allocation, it could be
Hmm.
tough.
Yeah, right. Wow. Um, how do you encourage others to support your missions? I imagine you get funding from a lot of different areas. What do you find connects with people the quickest to get them to care about the things that you care about?
Public support and funding, really, that's the core of what we do. That's how we're able to do what we do, is by the support from the public. Yes, monetarily, donations help us. And a lot of times, I think people overlook even just being partners in sharing or liking or the
Hmm.
raising awareness. You'll be
Yeah,
surprised about how many people still don't know some of the things that are going on, maybe in their backyard or maybe far
right.
away. So helping us spread the word has been really essential in what we do, and sometimes building our partnerships. And then also, I would encourage those within my profession that are already doing, especially particularly medical missions, to look up something called the Brochet Declaration. It's
Okay.
really a statement of ethical guidelines and principles that kind of just guide global health missions that I was alerted to. I didn't found it, a really great organization did. And it's a declaration that organizations make and say, like, okay, we're going to be involved in even what writing our own ethical principles and trying to follow
Yeah.
them. And beyond that, I would say my nursing colleagues, I would speak to you and really say, get involved in global health, especially global health leadership. If anything, this global pandemic has taught us that nurses were the focal point of
Hmm.
healthcare delivery. And we have this unique vantage point because of our training, because of our experience, different parts of healthcare. We look at things differently. Our approach
Hmm.
is different. And I would love to see more nurses, especially in global health leadership positions, because I don't see that. We'll be a part of it, the
Yeah,
actual
right.
delivery in the field, which is essential. But I think, in other companies, we've seen, like, even Google, Microsoft now has like a chief nursing officer. I think
Yeah.
more global health organizations should have a nurse definitely to sit at the leadership table, and would definitely, be beneficial.
Yeah, absolutely. That's such a great point. I mean, we hear a lot of people, especially the conversations I get to have on here about, nurses having a seat at the table and really
Yes.
nurse-led initiatives are so important because we have walked in the shoes of nurses, and it's hard to know what nurses are going to need unless you yourself are a nurse or are very familiar with it. Yeah, I think that that's such a great point. I'm glad you brought that up. What are your thoughts on nursing community in general?
Yeah.
How do you think nurses can benefit from a community like Nurse Tech that's virtual, or any community that they could join, different organizations, volunteer mission work?
I think it's super important for so many reasons. Really, first, even just camaraderie, in our field, it's not easy. I would say even healthcare in general, dealing with real life situations, things changing rapidly, and having to really step in as, or being seen really as a leader for your direct patient, a leader on your floor, clinic, etc. I think having an opportunity to hear from others that are experiencing
Mhm.
the same things that you are is definitely helpful
Yeah.
to continue on. And also, I think it's an opportunity to exchange ideas and even notes, if you will,
Mhm.
and to really see how much we're really connected.
Yeah.
Whether you're like me working in global health or in a hospital, we face a lot of the same, challenges, highs and lows. So I think
Mhm.
that's wonderful as well.
Yeah, I agree 100%. Um, Tell us what you mentioned a little bit some of the projects that you're currently working on. For
Yeah.
those that are listening or reading or watching this, what's the best way for people to connect with you if they are like, this is amazing, I want to be a part of it? What are some of the current things that you're working on, and how can people get in touch with you?
Absolutely. So right now, the Uofl Foundation is in the middle of a campaign. It's called Project WASH. So WASH stands for Water, Sanitation, and Hygiene. And it's really a campaign that's pushing forward the work that we've already done from the documentary that you mentioned.
Mhm.
So access to clean water is just one part of the equation. Also, once people have water, other than drinking it, there's so many things water is used for. Hygiene is a big thing in
Mhm.
sanitation. So we really want to empower our communities to know how to wash hands, but how can they wash hands if they don't have a facility to do so?
Right,
Or how can
right.
they, toilet in a way that's hygienic if they don't even have a facility to toilet or know how to do that? So
Yeah.
this whole campaign is part awareness and most part is delivery. And people can get involved by visiting www.uoflfoundation.org/wash.
Okay.
And I hope that you guys maybe put that in your description
We
there. People
absolutely
can catch
will.
that.
Yes.
Yeah, and people can either, donate or even really partner with us. It's a peer-to-peer campaign, so it's exciting. There are a lot of different people that are helping to fundraise and online, and we give people tools to be able to do so. So if they're involved in doing that, they can. And we also have open positions for other nurses that are like volunteer positions, like our
Mhm.
ambassador program that really gives voice to the work that we're doing. So I encourage people to just reach out to us on any one of our social media platforms, Uofl
Awesome.
Foundation, and get engaged.
Great. We talk a lot with nurses about nurses that are feeling like extreme burnout, or even
Mm,
going beyond changing their nursing role and wanting to leave the profession forever. We try to of course we want
mm.
to retain all the nurses that we have right
Right.
now, but part of that, I think, reigniting your nursing spirit is turning back
Mm.
into community work, and volunteering is such an
Yeah.
important part of that. I think that most nurses have that compassion gene that sometimes the light it gets dimmed, but volunteer work and turning outside of yourself is like the quickest way to spark it back up. So I love what you guys are doing. The work that you're doing sounds amazing. I'm gonna go like look up all of it right now. So thank you, Faith, so much for taking some time out for us, and it was awesome hearing your story, and all the things that you guys are doing globally, in your own backyard. And I know that it will inspire other nurses to get involved as well.
Awesome. Thank you so much, Brianna. And I'm excited to just continue this conversation even beyond.
Absolutely. Great. Well, thank you. We're all done.